No, because you're not the only one with a loved one in hospice care. Seems like we are living in a world today where we have moved from considering the common good to focusing on our own individual needs and wants. I'm not saying that this hasn't happened to me somewhat, and perhaps I'm in contact with folks of all societal levels every day in providing hospice care, so maybe I get to see and note this attitude shift more. I just got yelled at by a daughter of a hospice patient. Why? Because I called her mom, the patient, to set up the appointment, and not her, the daughter. She didn't say it nicely. She didn't calmly ask the team to always call her first. Nope, she just told me off, saying she can't believe I wouldn't have known this, and et cetera, et cetera. You know, I listened, absorbed her feelings. I've done this before, so I took a deep breath. And of course, I assured her I would do this and also notify the rest of the hospital team. You know, she went on to complain that the briefs were delivered, they were too big, and why didn't we send more than 2 packages of wipes, and why did it take 2 days for the box to arrive? This is a very simple example, but it's what I'm talking about. It's that entitled attitude that says, I should get what I want, I should get it right now, and even sometimes, I should have gotten it yesterday. You know, often in hospice care, it is the plea of the child regarding their parent. And may I just say out loud that it's often the case that the patient is calm and relatively comfortable. It's often the family members who, in their worry and their care for their loved one, they become really demanding, impatient, unsatisfied, and even angry with the hospice team. You know, I guess it's the old adage, don't shoot the messenger. Now, here's the thing. I get that my contact with people is at a very particularly stressful and needy time. They've been admitted to hospice, and generally they're confused, they have worry, and lots of fear. So my job is to assess their real needs, their physical needs, like pain relief or the ability to breathe. And then I can listen to the wants, and I'll do my very best to discern which is necessary in the moment, and then delivered skilled and compassionate care. And that's what we do on the hospice team. Is it because they're concerned and stressed? Of course, but sometimes that entitled, me, mine, now, it can be really difficult to receive, especially when we're doing our best, and especially when it's just a desire, not something that's truly needed. So this is a very simple example of our culture allowing more belligerent expression of feelings and desires. Maybe it's social media, and feeling it's okay to share all of their feelings in the moment at that person on the other side who must just take it. The hospice team has many patients on their roster, and generally speaking, we hospice workers are compassionate people, and we are always desiring to serve our clients in the best and most caring way possible. May I ask that we all take a deep breath, consciously consider what we're saying. Is it a true need in our request in the moment related to someone's life comfort? Is it a want that's really not urgent? And we can exercise some patience in waiting for that desire to be fulfilled. And mostly, let's just treat each other and see each other as a person and relate with respect and dignity at all times. Thanks for listening to my rant of the day, and know that Brenda and I, along with all hospice team members, are doing our very best to care for you and your loved one. Click on the link below, get our booklet. It's a crash course in hospice care, and watch all of our videos. We so appreciate your watching. We are there to serve you. And our motto is care is treatment.